What you should know about preeclampsia. I'm sitting here with Dr Ellie Bailey. She's from Sydney Adventist Hospital. She's an obstetrician and a gynaecologist and a mother, which is awesome. Thank you so much for being here.
Thank you. You're very welcome.
So preeclampsia, it happens to, women in pregnancy.
Yep.
Is there anything that tells us you're going to get it, or what are the
That's a good question.
precursors?
So preeclampsia is when you have abnormally high blood pressure in pregnancy, and it also often comes with other problems like protein, your kidneys getting leaky of protein,
Right.
or your liver or kidneys not working as normal.
Due to pregnancy? Due to falling pregnant? Or
Yeah, it is to do with being pregnant, and it's got stuff to do with the placenta. And certain people are at risk of getting it, people who've had it in a previous pregnancy, people who've got blood pressure problems even when they're not pregnant, so
Right.
people who've got chronic hypertension, people who have a family history of preeclampsia, so if your mum had it or your sister had it, you're at higher risk.
What are the symptoms?
So there's often no symptoms. So that's why we test people's blood pressure every time they come to the antenatal clinic, because there's often no symptoms, and the first time we'll pick it up will just be at a routine visit when we find the blood pressure is high. We then go on and do tests to see whether the blood pressure is affecting other organs like the kidneys and the liver. And also we need to check on the baby as well to make sure that the baby's still growing as well and as big as it should do.
Because it can affect the way the baby develops, or...
Yeah, so it affects the blood flow to the baby, and in turn the babies can be smaller than they should because they're not getting the food that they need to grow.
And then you're at risk of having like a preterm labour or a preterm baby?
Well, not really that. You're at risk of having a smaller baby than you should. And I guess the possibility from that is that there's a small risk of stillbirth for the really extreme cases where the babies aren't growing properly at all. So we like to monitor the babies and make sure that they're growing to their full potential.
So how can we treat preeclampsia? What usually happens? What's the treatment plan for people with preeclampsia?
So the absolute ultimate treatment is finishing the pregnancy, so having the baby. That fixes you almost immediately.
Right.
Often people can't do that because they're too early and the baby would be too premature. So the aim then is to lower the blood pressure with medication until you can get the baby and the mum to a safe gestation to deliver the baby, which is normally after about 30.
So how early does preeclampsia come on?
So by definition, any time after 20 weeks. Most of the time we see it at 35, 36, 37 weeks, but occasionally you get really severe early onset cases at 23, 24, and that's really quite dangerous and quite stressful for the mum and the obstetrician.
Right. I know Kim Kardashian had preeclampsia.
Oh, did she?
Yeah, so I think, does it affect any of your other pregnancies if you have it?
So once you've had it for your first, you're more likely to have it for your second, but it's normally most severe in the first pregnancy.
And so how can we manage it? How do we look after ourselves if you have preeclampsia?
Once you have preeclampsia, it's just attending your appointments with your caregiver, your obstetrician or your doctor, making sure your blood pressure is being monitored carefully. Often it's time to give up work if you're still working.
Okay.
And bed rest doesn't make any difference, but just trying to lower your stress is always going to help. And then it's just taking your medications, having your monitoring, having your ultrasounds of your baby, and trying to get through to as far along in the pregnancy as you can to safely have your baby.
Wow. Thank you so much, Dr.
That's all right.
Ellie, for being here and sharing that with us. I hope that's helped you. There's so many topics here at Mums at the Table, so do check us out on Facebook and YouTube, and be sure to subscribe. Keep it locked right here at Mums at the Table.